In our modern era, infertility is a problem that affects many people. According to the National Infertility Association, 1 in 8 couples in the U.S. alone have trouble getting pregnant or sustaining a pregnancy. Research has provided more insight as to what could be the causes of infertility in both males and females. For our purposes, we will be focusing on the physiological causes of infertility, specifically chemical and psychological causes.
We will start by discussing chemical causes. For instance, a common chemical found in many everyday plastics may be causing fertility problems in males. A recent study has found that exposure to DHP may correlate with lower sperm motility, which makes it harder to reproduce. DHP is a chemical that helps make plastics flexible, so you can imagine how much we interact with this chemical every day. Although this substance breaks down in the body after a few days, the results are important in determining the effect of chemicals on infertility in humans. In humans, DHP acts as an endocrine disruptor by binding to the receptors in the cell membrane. The disruptors are able to bind with the receptors, but instead of eliciting a response, the receptor simply becomes blocked and is unable to bond with natural hormones. This, therefore, inhibits normal cellular responses. The study indicating this correlation was performed by Skåne University Hospital in Sweden. The sample was taken from the general population of adolescent males in Sweden, rather than primarily those with reproductive concerns. This eliminated the effect of outside causes. The metabolite levels of DHP was measured in urine to indicate the exposure that the males had to the chemical. The sperm maturation and forward movement was measured and then paired with the metabolite levels in each subject's urine. This was a correlation study rather than a causation study, but in general, the higher metabolite levels coincided with less mobile sperm. The sperm of the males who were in the top quarter of exposure had 46% forward movement, while the sperm of the males who were in the lowest quarter of exposure had 57% forward movement. The difference in forward movement may be negatively associated with fertility.
In addition to chemical causes of infertility in males, polycystic ovary syndrome is a large cause of infertility in females. The cause of infertility in polycystic ovary syndrome comes from the fact that most women with PCOS suffer from insulin resistance and therefore hyperinsulinemia. Insulin resistance is the inability of insulin in the bloodstream to decrease blood glucose levels. Therefore, there is an elevated level of insulin in the bloodstream, hindering ovulation and leading to infertility. The effectiveness of metformin, an insulin-sensitizing drug, was tested using many different experiments in which its effects are compared to that of a placebo as well as to the effects of clomiphene citrate. A study by Nestler was conducted in which the effects of metformin alone were examined versus the effects of metformin added to clomiphene citrate. 34% of women ovulated while taking metformin alone, while only 8% of women ovulated while taking a metformin placebo in addition to clomiphene citrate. This shows that the metformin treatment was more efficient, showing that the insulin resistance and complementary hyperinsulinemia is a factor contributing to infertility in women with PCOS. In a separate, randomized, placebo-controlled study, women with PCOS were given a monotherapy drug treatment. They were either given metformin or a placebo. Results show that during the monotherapy period, 34% of women in the metformin group ovulated, while only 4% of women in the placebo group ovulated. Women in both the placebo and metformin groups who did not ovulate during this 5-week period were administered clomiphene at a dose of 50 milligrams daily for 5 days. At the end of this time period, 90% of women in the metformin group ovulated as opposed to 8% of women in the placebo group. These results depict the effectiveness of metformin as an insulin-sensitizing drug because the ovulation rates of the metformin group greatly increased compared to the ovulation rates of the placebo group, even with the addition of clomiphene.
Beyond chemical causes, there are also psychological causes that can play a factor into fertility. In 2014, an article based in India was published in the journal Andrology that was entitled The Effect of Psychological Stress on Fertility Hormones and Seminal Quality in Male Partners of Infertile Couples. The purpose of this study was to assess levels of FSH, LH, serum testosterone, and sperm quality, measured in sperm count, motility, and morphology within these males. These areas were tested after having them take a hospital anxiety and depression score, more commonly known as HADS, to see if a relationship existed between these factors. The HADS test is made up of two scales, one to measure anxiety and the other to measure depression, both of which are considered forms of psychological stress. In this study of 70 males, 19 of them, or 27%, had a high score for the HADS scales. As shown in the figures, serum total testosterone levels and sperm count had a significant negative correlation with the increasing HADS total score, showing that an increase in psychological stress correlated with a decrease in these areas. In addition, sperm motility had a significant negative correlation, while instances of morphological deformities had a significant positive correlation. On the other hand, FSH and LH had a significant positive linear correlation to an increasing HADS score. This is a result of the lower testosterone levels being related to these other hormones on a negative feedback loop. Based on the data, the group concluded that there must be some unknown inhibitor released during chronic stress that affects the production of testosterone and subsequently these other hormones, leading to an overall reduction in fertility.
In conclusion, phthalates, anxiety and depression, and insulin resistance all have evidence to suggest that they are possible causes of infertility. With any luck, further experimentation can build on this initial research and hopefully lead to more effective treatments for infertility in both males and females.